Well, there's a lot of information available, but one area that folks can go to online is Metro Health's Progress and Warning Indicators dashboard. These are metrics that were developed by the Health Transition Task Force initially to provide information about when it would be a good time to reopen the economy. And since we've now migrated past that, they were really designed to also indicate if we started seeing a larger number of cases in our community so we could have a sense of what was going on and when. The ones to focus on would be the daily case counts, the hospitalization data, the doubling time, and the percent positivity rate. Well, that is a metric that we've refined to make sure that we account not only for cases of COVID in our community that are symptomatic, but also those that are asymptomatic. The data have shown that we're seeing a large percentage, not just here in San Antonio, but even worldwide. It could be upwards of 40% of positive cases actually have no symptoms. And so that epi curve that describes the case counts includes patients who are symptomatic and when they started getting symptoms. It also includes those that are asymptomatic as defined by their test collection date or when those results came in. The hospitalization data is broken up into a couple of categories. One are graphs that show the rate and the number of hospitalized COVID patients, as well as those that are on ventilators and in ICUs in our community. It really gives you an indication of sort of the severity of the disease. The health system stress score really focuses on not just the patient volume, but the capacity of our hospitals in our community and what's readily available. Over time, we see more cases in some respects because we are doing more testing, but we are seeing a lot more cases more recently in the last 7 to 10 days of hospitalized cases. And how we admit patients to the hospital are criteria that really don't change. And so we do know that when we see an increase in those patients, that we have a higher number of acutely ill patients who require that level of care. Another metric to consider is the doubling time, and that is how many days does it take for our case number to actually double from the previous case number. And as that shortens, that simply means that we're seeing a larger number of cases over a shorter period of time, which means they're rising. The other metric to consider is the percent positivity rate. In other words, of all the tests that we're doing, how many are actually becoming positive? We're trying to do a lot more testing in general so that we can identify the disease, and that will certainly lead to an increased number of cases. However, what you really want to look for is the positivity rate, because if that is increasing, then it's clearly indicating that the disease is being spread more frequently between person to person, so we're seeing it at a higher rate of increase. What you see is really a reflection of behaviors that preceded the current time, anywhere from 2 to 3 weeks. So what we think is much of the recent increase in the number of cases over the past week or 10 days is really reflective of the increased socialization that began on or around Memorial Day. So it takes 2 to 3 weeks for an impact to be reflected on these graphs. Conversely, it means that if we have interventions that we're really trying to implement now, it may take us another 2 to 3 weeks to see the impact of that. It's very important to know what's going on with this virus in our community. There are a lot of sources of data out there, and it's really important to rely on those that we know are reliable and valid. And these, if you focus on them, I think will give you a true picture of what's going on in our community.